Hello, my name is Dr. Hwang. I'm an expert in the nose job in Korea. My clinic is 옴므앤팜므 plastic surgery in Seoul, Korea, and I'm doing my nose job from the 2000 years. I have been more than 23 years only for the nose job. And I'm gonna present about the projection of the tip operation method. And there are many operation methods, but my favorite for operation method. The first time, I'm gonna present about the diamond tip-plasty, which means only the using a cartilage work. There is no strut and no any other material in the tip. I'm gonna present about the diamond tip-plasty for the first time. There are many operation methods for the caudal rotation and the tip projection. As I told you, I'm going to present about the diamond tip-plasty and lateral crural spreader flap and the caudal septal advancement technique and the tongue groove Y extension graft using folded conchal cartilage. First time, I'm going to present about the tip projection with the lower lateral cartilage suture technique. I named this operation method for the diamond tip-plasty. Actually, reducing the lateral crural divergence angle is the most important procedure in the Asian nose. Reducing a divergence angle, making the tip narrow, and before the operation, it looks a rectangular shape. After the reducing a divergence angle, it making a narrow nasal tip, and it looks like a diamond shape. So I named it for the diamond tip-plasty. So this is the operation procedure. And after the exposure in the lower lateral cartilage, full exposure is the most important. And I always cutting the dermal cartilage ligament for the tip projection. This is the first step for the piercing number 50 nylon at the caudal border of the lower lateral cartilage. And this is the second step. This is the third step. At the piercing suture at the cephalic border of the lower lateral cartilage. And this is the fourth step of the cartilage diamond tip-plasty. This piercing suture at the caudal border of the lower lateral cartilage. And the suturing was done. And just like this, you can make a tip projection 4 to 5 millimeters. Actually, it depends on the size of the lower lateral cartilage of the patient. But regularly, the minimum is 3 millimeter and the maximum is 5 millimeter tip projection can make. This is the final picture of after the diamond tip-plasty. He has a severe hump and tip is very low. After the diamond tip-plasty, you can make a tip projection without any material or any strut. And this is another case. She has a very bulbous tip and downward tip, but after the diamond tip-plasty, she can make more tip projection and narrowing of the tip. So just like this, the diamond tip-plasty has very many advantages. So because you have no strut, so there is no nasal airway obstruction, and natural tip movement is possible, and more movable tip than the other technique. It can make a very soft tip because there is no strut. Just like septal cartilage or costal cartilage strut is very hard. And disadvantage of the diamond tip-plasty is actually it is technically very difficult. So many doctors trying to do this, but it is not so easy. So it needs a very long time for the learning curve. And in case of the very small lower lateral cartilage, the effect is low because she has a small cartilage. And so it's least stronger than the other technique. And because of the least strong, so it is a least nasal tip projection. But you can, if there is a very strong and big lower lateral cartilage, then you can make a 4 millimeter to 5 millimeters tip projection. The diamond tip-plasty's most advantage is there is no strut, and you can make a tip projection 4 to 5 millimeters, and it can make a movable and a natural tip-plasty. It is very important and very useful for the patients. Thank you. This is the end of this presentation, and next time I'm going to present another method for the tip projection. Bye bye.